We were at the Gaylord Convention Center for Obesity Week in Washington, D.C.
Nice. What was that about?
Obesity Week is an annual conference always held in the fall where professionals from around the world, it's not just for the U.S., come and meet and discuss what treatments we've been doing, how they've been working, what improvements have been going on, or what is really fading out. And then we introduce new treatments and how they're expected to go and how you can market them or what patient demographic would work for that particular treatment.
Nice. Any treatments in particular that caught your attention? Like any new treatments coming up?
It's not a new treatment, but the one that they were using in office, the EGD through the nose.
The intranasal endoscopy is something that has been gaining more popularity. Every patient that needs bariatric surgery and some patients that are getting a balloon are required to have an endoscopy prior to procedure. The reason for the endoscopy is to check if you have any hernias or ulcers or anything in your stomach. The typical way of doing an endoscopy is to be put under a mild sedative, and they put a camera through your mouth into your stomach. And there are some restrictions when they do that because you cannot drive afterwards, no taking medications or drinking because you've been put under medication. However, when you do the procedure in office, it's actually done while you're awake and it's done through your nose. So that what they do is they stick a smaller scope through your nasal cavity into your stomach and they can get the same results with a quicker treatment, and it's in office instead of going into a surgery center or into a hospital.
It's very cool.
So it's like in and out. I thought that was interesting.
The sleeve is still the most popular of procedures because it's the least amount of surgery but most amount of outcome in terms of time in the OR, incisions, changes to your anatomy. The lap band has kind of faded off a little bit because the outcome versus surgery is not the same in terms of effect versus a sleeve or a bypass. You're going to lose more weight with a sleeve or a bypass than you would with a lap band. And the, I guess, concerns or side effects, something like that, are not as great when you have a sleeve or a bypass versus a band.